Thank you, Dr. Kabil, and nice seeing all the friends after a long time. So, good afternoon, everyone. So, some of the things that I really thought, based on my personal interactions with the hospitals and some of the projects that even I worked personally. Um, One was like basically the how do we bring in AI in the diagnostic part that could really help in speeding the results and getting the accuracy in the outcomes, etc. For example, when the pneumonia kind of issues come, in the first phase of COVID was there. Every X-rays were like you need to really go, undergo kind of screening, etc. So in fact, some of the cloud companies, especially Alibaba-based companies, etc., they came up and with good tools. So they were kind of combining the cloud and AI and the diagnostic part of it as a comprehensive solution. They were offering per case kind of a model to the hospitals where each and every X-rays or CTs can be really screened and through AI engine, and outcome can really predict whether the patient is going to have COVID or not. And I think we should have extended this to beyond COVID, and maybe in terms of a lot of screening, etc. Especially where we have too many population of patients coming in, we have less the radiologists, etc. But what I found as a problem in adopting that particular technology from the diagnostic centers, especially the radiologists, is the accuracy of the outcome. Like they thought even after the engine gives the result, they have to really physically go through some of the results for them to validate. They were not ready to sign off that report as is. So there was hesitation from the the radiologist. I think the accuracy of the data, bringing more test cases for the AI engine to really learn and then bring the the quality is very important. But I think we should not stop with COVID related queries. We should go beyond that, and then especially with hospitals where like a large footfall of patients coming in, and especially government hospitals, etc. We should start really adopting how the AI can really help in screening process and automate some of the reports. And then only the complex cases can be really given to the doctors, and the doctors can really take it up and review it. So this is one technology I thought it started, but somehow it didn't really taken up big way. So this is one thing. Second one is the the symptom checker, for example chatbots. Almost every hospital had in their portal chatbots for screening COVID, right? And I thought it was a very great trend to start with, where if you tell some of your symptoms, then automatically identify whether you have COVID or not. Then you are routed to particular specialty clinics or doctors, etc. Again here, I thought if really we can bring in, instead of just adopting some of the ready-made chatbots, actually the hospitals can work with some technology companies, bring in more intuitive chatbots for symptoms related. Actually this could really help screening and triaging the patients, etc. This is one thing I really thought that technology adoption started, people started using it, but then it's slowed down. So this is something that again I would really hospitals should actually try. Technologies companies should really work very closely and bring up as many use cases as possible for the some good specialties. Third one was the Internet of Medical Things. Though it's not something started in 2022, but I think it's going to be, in terms of implementation and adoption, it's going to be very effective in 2022. A lot of hospitals did pilot. They were not seeing the success, or the cost was very high, so they gave up. But now again, they're coming up actually with building the tools and tele-ICUs and monitoring, especially where the chain of clinics and multiple branches are coming up, where you want to have a centralized team, like critical care team, monitoring the machines, monitoring the screens and helping the patients. So this is something that I think as a business model, it should evolve, not just the technology. The combination of clinical technology and business, if it can really handshake, I think this is going to really have a huge impact. And I think the more and more adoption of IoT is going to happen, especially the medical things, it's going to really make a big difference. Because these 3 or 4 when I mentioned in the top list, because these all can really have a business use cases that can have a revenue models, and can really help in managing with the less number of clinicians, less number of radiologists. You can manage more patients. So this is going to help both the patient community as well as the hospital, the business model as well. The next one, especially when I used to travel a lot to US, I found a company in the US, but then they said a lot of companies in India as well making it, is the robots just to help, especially the disinfection part of it, or telepresence part of it, going around the hospitals taking pictures of the different parts and sending it, or the doctor wants to talk to a particular patient, the robot automatically goes and stands next to the patient and connects to the doctor. Especially this disinfection, I really found like more than 100,000 test cases have been made by some of the robotic companies. So this is something that I think we should really start adopting. And when I was interacting with the US company, they were saying 7 Indian hospitals are already did a pilot and they're procuring more robots. So it was quite an interesting thing. But though not too many use cases came out in the market, but very good successful pilot projects happened, especially for the going for rounds and taking vitals, etc. These robots are used. So I think that is something that's going to really pick up, especially the combination of extended reality and the robots can really make a huge difference in telepresence and telecommunications, etc. And of course, the most important thing which I personally used is the 3D printing part of it. We use a lot in the dental technologies, where the doctors can really use it for two purposes. One, of course, for implants and other testing and training purposes for the doctors, etc. Even one big use case that I found was the organ transplantation, especially the transportation part of it, etc. So they use basically they wanted to predict even what is the possible success rate of this particular organ if it can be used in the during transportation, post transportation, etc. and how that will be really kept for a longer period of time to during the transportation, etc. So especially the bioprinting technology is going to really help a lot in this, and there are some very good use cases are there. But I think it will take some time for India to really start adopting, because generally my personal experience is there are 3 types of hospitals in India. One, the 15 to 20% of hospitals where they wanted to try every new technology. They want to be in the upfront and they wanted to explore. They spend money and they have CIOs who are really tech savvy and who wanted to take risks, and even they're not worried about blame games, but they just wanted to try new things. And there are 15% or 20% of hospitals, they would never adopt technology. They would just be happy with the billing system. They just want to make deal with their own thing. In between, there are 60% of hospitals, they want someone else to test it, try it out and tell them the results, and then or it should become mandatory that they should use it. Then they start adopting the technology, whether it is telehealth or whether it is enterprise level systems. So I think the leaders should really take initiatives, and they should really including the I'm saying big data. We've been talking about NLP based systems, especially where we implemented data science, especially with huge NLP based query system. And after we implemented, I found that the first time that CFO when really logged into the system and asked question, hey, when was this particular this specialty started making money? Kind of a very simple English question to the system, and it started bringing the results to him. He felt that he need not have gone through a huge Excel sheet based analysis or talking to the IT team, getting the data, etc. He was able to just talk to the system in English. He was able to get the result. I think we have to really bring out a lot of use cases where the end users, both from the hospital management side as well as the patient side, can really see the real benefit. The value of the investment should be, visible, tangible benefit should be there. I think then it makes a huge sense. So that's all I wanted to say. Thank you so much, Dr. Kapil.